So now I'll be conducting the administering an intramuscular injection. So first thing to do is the assessment. In assessment, we assess the client's allergies to medications, specific drug actions, side effects, and adverse reactions, as well as the client's knowledge of and learning needs about the medication, the tissue integrity of the selected site, the client's age and weight to determine site and the needle size, and also the client's ability or willingness to cooperate. So next is the assemble of equipment and supplies needed for this procedure. So I have here the medication administration record or the computer printout. I also have the vial of sterile medication, the syringe and needle of a size appropriate for the amount of solution to be administered, the antiseptic swab, and also the clean gloves. So next is check the medication administration record. To check the more, we check the label of the vial carefully against the more to make sure that the correct medication is being prepared. Next is follow the 3 checks for administering the medication and dose. So read the label on the medication when it is taken from the medication card, before withdrawing the medication and after withdrawing the medication. And also, after checking it, confirm that the dose is correct. So next is organize the equipment. So I've already organized the equipment. Now I'll perform hand hygiene and observe other infection control procedures. So next is prepare the medication from the vial for drug withdrawal. Good day, ma'am. How are you doing?
I'm doing good.
I'm Bridget Survey, student nurse, and I'm here to demonstrate the administering of intramuscular injection. So, may I first verify your identity by stating your complete name, including your surname, your first name, and your birthday, also your birthday and your age.
I'm Christine Aleda Esteve. My birthday is July 25, 2004. I'm 17 years old.
Okay. May I see your wristband? Okay, thank you. It seems that you're the patient. So, intramuscular injection is a type of venipuncture that is given into the central area of a certain muscle to distribute medication to the cardiovascular system by allowing it to be absorbed into the bloodstream at a faster rate and at a larger volume than an oral or intravenous medication would allow. So Dr. Santi has ordered you an epinephrine skin test. So epinephrine is a hormone and neurotransmitter used to treat allergic reactions, restore cardiac rhythm, and control mucosal congestion, glaucoma, and asthma. Epinephrine also is an injection that is indicated in the emergency treatment of allergic reactions, including anaphylaxis to stinging insects and biting insects. So, this medication will produce a small wheel, sometimes called piglet. Parang kagat lang ng lamok ang itsura niya. So, do you follow me?
Yes.
Okay, so this procedure could take 3 to 5 minutes of your time. Is that okay with you?
Yes.
Okay, may I know if you have any allergies to medications? And also may I check or inspect the side of your arm? Okay, ma'am, thank you. So, I've already washed my hands, prepare the supplies and equipment, draw the curtains and close the door. And also, you can tell me immediately if you experience any pain or discomfort during and after the procedure. Okay, is that okay with you?
Yes.
So, may we now proceed?
Yes.
Okay, thank you. So, how are you doing, ma'am?
I'm doing.
I'll now proceed with the administering of intramuscular injection. So, after preparing the patient and explaining the purpose of the medication and how it will help, using language that the client can understand, include relevant information about the effects of the medication. I've also explained it to the patient of the definition, the process, the procedure, and the possible side effects. So, I'll now select, locate, and clean the site of the area. So now, I'll check again the label of the medication. So, in selecting a site of the area, there should be no skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has been used frequently. If injections are to be frequent, alternate sites, avoid using the same site twice in a row. Locate the exact site for the injection, put on clean gloves, and clean the site with an antiseptic swab using a circular motion. Start at the center and move outward about 5 cm. 5 cm, 2 inches. So I have here the antiseptic swab. Mom, may I just straighten your arm? So my patient here is lying in a supine position. Next is transfer and hold the swab between the third and fourth fingers of your non-dominant hand in readiness for needle withdrawal, or position the swab on the client's skin above the intended site. Allow the skin to dry prior to injecting the medication. So I have here the syringe with the medication, which is the epinephrine. Now prepare the syringe for injection. Remove the needle cover and discard without contaminating the needle. If using prefilled unit dose medication, take caution to avoid dripping medication on the needle prior to injection. If this does occur, wipe the medication off the needle with sterile gauze. Inject the medication using a Z-track technique.
Use the ulnar side of the non-dominant hand to pull the skin approximately 2.5 cm or 1 inch to the side.
So in count of 3, ma'am, I'll inject it in 1, 2, 3. Are you ready?
Yes.
Okay, thank you.
Hold the barrel of syringe steady with your non-dominant hand and aspirate by pulling back on the plunger with your dominant hand. Aspirate for 5 to 10 seconds. If blood appears in the syringe, withdraw the needle, discard the syringe, and prepare a new injection. If blood does not appear, inject the medication steadily and slowly, approximately 10 seconds per milliliter while holding the syringe steady. After injection, wait 10 seconds. And then withdraw the needle smoothly at the same angle of insertion. Release the skin, apply gentle pressure at the site with a dry sponge. If bleeding occurs, apply pressure with a dry, sterile gauze until it stops. Activate the needle device or discard the uncapped needle and attach syringe into the proper receptacle.
So, ma'am, how are you feeling right now?
I'm fine.
So, you might experience minor side effects or adverse effects like headaches, dizziness, nausea, vomiting, or constipation, if ever, and other things. So, please tell me immediately if you experience those so I can refer it to the doctor. So, I'll now record and report all the findings, including the time of administering, drug name, dose, route, and the client's reactions, your reactions. So, I will also assess the effectiveness of the medication at the time it is expected to act. So, you may now relax and thank you for cooperating. I now go record and report, wash my hands, clean the area, and in order to lessen the contamination in this area. So, and that would be all for the administering of intramuscular injection.